Hi, my name is Fiset. I'm OB/GYN here at Rutland Regional Medical Center. I knew I wanted to become a doctor actually when I was just 2 years old. My favorite book was Curious George Goes to the Hospital. And I read it so much that I actually had it memorized and could flip the pages, and it looked like to anybody, who wasn't in the know that I was actually reading. Of course, I was 2, I wasn't actually reading, but definitely surprised some people there. So my mother has had a great influence on making me the kind of doctor that I am today. First off, she's the mother of 4, and I'm an OB/GYN, so she's always been very interested in pregnancy, loves it, loves babies, loves the whole process, and certainly as the oldest of the children, I saw that and experienced her other pregnancies as, a sibling in the house. My mother is also, she's a rock star. She always managed to do everything, and certainly, made us feel like we could do anything too, anything and everything. What I like about practicing in women's health is the opportunity to follow women throughout their lifespan, to take care of them when they're trying to not get pregnant, then when they're trying to get pregnant, through their pregnancies, through the menopause transition and beyond. It's a really wonderful thing to be part of the whole lifespan. I became a doctor in OB/GYN for a number of reasons. I did like primary care quite a bit as I was going through medical school, but I was drawn to OB/GYN specifically because it had a lot of the elements of primary care, taking care of people throughout their lifetimes, but it also had the additional aspect of obstetrics, which is something I really enjoy. The thing I like most about obstetrics is that it's not pathology. Pregnancy is a normal process, it's a healthy process, and it's a happy time, and so it's really a joyful thing to be part of that. I've been really impressed by the collaborative spirit of Rutland Regional Medical Center. It's above and beyond, I think. I think that all of the physicians really have wonderful camaraderie. I've met many who have gone out of their way to say hello, to introduce themselves, to also when I refer a patient, to really let me know what's going on with that patient. I've loved working with the pediatrics team here. So obviously I see them a lot as an OB/GYN, and anytime I'm on the labor floor, they're around. And I think they're an awesome group of people. I think that we're really lucky to have every single one of them be great. The general surgery has also been really wonderful. I see them when I'm in the operating room, and they've been very friendly. I found Rutland Regional Medical Center to be extremely friendly. So what made me come to Rutland Regional Medical Center? I like that it is a small community hospital that is very tight-knit, but that also has everything that you need. So you get the sort of personal attention, and it's not sort of a situation where it's so huge that everybody's disconnected, nobody knows each other. But it has enough resources that we can really provide excellent care. So I didn't want to be someplace that was so small that really I couldn't practice the kind of medicine that I wanted to, but also not so big that you're lost in the crowd. I like to think that I treat every patient the same way that I would a family member. I care about the whole person. I care not just about the complaint that they're coming in with, but also what's going on in their lives and socially that's potentially impacting their overall wellness. I think that any time that you can really make a difference in somebody's life, that they appreciate the care that you've given them, that you did something for them that really changed their quality of life. And those are all best moments. And you just you think about the most recent ones, but luckily there are many.